Hello everyone, welcome to the channel. On my previous video I talked about our spinal nerve plexuses and the various spinal nerve plexus like cervical plexus, brachial plexus, lumbar plexus and sacral plexus. What are the parts of a one spinal nerve and how this plexus formation occurs. So if you have not seen that video, then click on the I button and watch that video now. Today I am going to talk about our cervical plexus and brachial plexus. So I will try to cover both as much as I can, but these two are very complicated, so try to concentrate. Okay, तो इधर में जो आप फोटो देख रहे हो, इधर में क्या लिखा है C1, C2, C3, C4. एक्चुअली ये बहुत ही शॉर्टकट प्रेजेंटेशन है जो हम आपको फर्स्ट सर्वाइकल स्पाइनल नर्व, सेकंड सर्वाइकल स्पाइनल नर्व, इतना लंबा नाम आपको नहीं कहेंगे, तो इसको शॉर्टकट कहेंगे C1, C2, C3, C4. Okay, so as you can see in this photo, these are root of the spinal nerve. Now after the root, next part is known as trunk. So from this trunk divisions arises, and via these divisions one spinal nerve connects with another spinal nerve. Okay, so as you can see, this is the trunk part of C1. One division is arising and entering into the C2. From the trunk part of C2, one division is going to the C1, another division is going to the C3. From C3 like this, from C4 like this. Okay, so after the division, the next part of the spinal nerve is known as cord. So as you can see, this is a cord of C1, C2, C3, C4. This has cords, and from these cords multiple branch arises. Suppose there are branch of C1, branches of C2, branches of C3, C4. Also, the branches can arise from the division, the branches can arise from the trunk, the branches can also arise from the root. So as you can see, this from the root of the C1 spinal nerve, a branch arises and it goes along with the hypoglossal nerve. And I already told about in my hypoglossal cranial nerve video, you can check out that this branch goes along with hypoglossal nerve and it supplies into geniohyoid muscle and thyrohyoid muscle. Okay, after giving branch to geniohyoid, thyrohyoid and formation of ansa cervicalis, the C1 nerve gives one division to C2 nerve. Okay, now from this division few branch or few fibers arises which supplies our rectus capitis group of muscle, then longus capitis muscle, then splenius cervicis muscle partially, and levator scapulae muscle partially. So this is the end of C1 nerve. Okay, if you forget unfortunately that the branches of ansa cervicalis, then I am reminding you that the branches of ansa cervicalis supplies the infrahyoid group of muscles. Okay, so in this group there comes omohyoid, thyrohyoid, sternohyoid. So all these muscles are supplied by these ansa cervicalis branches except thyrohyoid, because the C1 nerve directly supplying geniohyoid and thyrohyoid muscle. So ansa cervicalis does not require any branches. Okay, this thyrohyoid muscle does not require any branch from ansa cervicalis. Okay, crystal clear, finish. Now I am proceeding to the C2 spinal nerve. Now as you can see, the root of C2 spinal nerve, one branch is arising and it is going to formation of ansa cervicalis. That part is gone. Now the division which is connecting with C1 spinal nerve, from this division few branch arises which supplies our rectus group of muscle, longus capitis group of muscle, then trapezoid muscle, sternocleidomastoid muscle. Okay, one division is arising from C2 and connecting with C3. From this division three nerve arises. One is lesser occipital, another is greater auricular, another is transverse cervical. Okay, now the fate of lesser occipital nerve is it supplies the part of our skin of our scalp. Okay, it supplies the posterior part of our neck and superior part of our ear. Okay, so this is my ear and this is the superior part. This greater auricular nerve connects with or combines with our facial nerve and supplies our parotid gland. It supplies our posterior part of our ear. It connects with our vagus nerve, the auricular branch of the vagus nerve, and supplies our auricular area, the tympanic area and the outer skin of the ear. Then it supplies our mastoid bone, this temporal bone, and this temporal bone has two parts, one is pectoral, another is mastoid. So it supplies our mastoid area. So this is the fate of greater auricular nerve ends. and then comes transverse cervical nerve. This nerve supplies our this platysma muscle. Okay, there is one muscle known as platysma and above this skin. So platysma muscle and above the skin. From the root of C3 spinal nerve, sometimes in few people a branch arises which helps to formation of ansa cervicalis. Some people does not have this, so it's quite normal. And one nerve arises from the root which supplies our scalene group of muscle, levator scapulae muscle, then rectus group of muscle. Okay, that's it. Now this C3 also gives a division to the C2 nerve, and from these two nerve arises, one nerve goes to the trapezius muscle and another nerve goes to the suprascapular area. From this C4 a few branch arises which supplies our levator group of muscle, scalene group of muscle, levator scapulae, scalene group of muscle, longus group of muscle, and so that's all. From C3 one branch arises, from C4 one branch arises, from C5 also one branch arises. Now this three branch merges together and forms a nerve which is known as phrenic nerve. This phrenic nerve supplies our diaphragm, the muscle in between our chest and abdomen. Okay, so this cervical plexus ends here. So now I am talking about this photo. So as you can see in this photo, this is a photo of brachial plexus. As you know that this brachial plexus forms from the C5 spinal nerve to the T1 spinal nerve. ओके, मतलब ये जो आप फोटो देख रहे हो ये है आपका ब्राकियल प्लेक्सस का फोटो जो बनता है आपका C5 मतलब 5 नंबर सर्वाइकल स्पाइनल नर्व से लेके आपका 1 नंबर थोरासिक स्पाइनल नर्व तक. ठीक है, C5 टू T1 हो गया. अब इससे देख रहे हो, जैसे आप देख रहे हो कि फोटो में बड़े बड़े से दिखा हुआ है. एक पहला पार्ट है रूट, फिर आपका ट्रंक, बीच में आपका डिविजन, फिर आपका कॉर्ड और बहुत सारे ब्रांच. ठीक है. So as you can see, this C5 and C6 together forms one nerve, C8 and T1 forms together one nerve, and C7 remains alone. C7 is like Sakht Londa. Okay. Okay. Now as you can see, the root from C5 one branch arises, which I already talked about few minutes ago, that C4 and C3 from their roots also one nerve arises. So these three nerve combines together and forms phrenic nerve. For the root of C6 spinal nerve, a few branch arises which supplies our adjacent cervical muscles. Similarly, C7, C8, from the root of them, few nerve fibers arises which supplies our adjacent muscles. Okay. From the root of first thoracic spinal nerve, no branch arises. Okay. We are talking about C5 nerve again. So at the root part, one branch arises which goes and forms the phrenic nerve with C3 and C4 gone. After a few distance, another nerve arises which goes to our deep scapular nerve arises, which is known as deep scapular nerve. So it supplies our deep part of our scapula, whatever the structure there is. And another nerve arises which also connects with C6 and goes downward, also connects with C7, goes downward, also connects with C8, goes downward, also connects with T1. So this entire lengthy nerve is known as long thoracic nerve. Okay, so I will talk about this nerve in future. So the trunk formed by C5 and C6 remains upward, we call it superior trunk. C7 remains in middle, so it is middle trunk, and C8T1, and the trunk is formed by C8T1, it remains downward, so we call it inferior trunk. Okay, from this trunk divisions arises and connects each other. So from these divisions no branch arises. Okay, keep it simple. This superior trunk, middle trunk, inferior trunk goes little forward and it changes its anatomical position. This superior trunk goes laterally, middle trunk goes posteriorly, and the inferior trunk comes to the medially. Now from this lateral cord, two branch arises. One branch goes to our lateral pectoral muscle. This is the pectoralis muscle, so lateral part of pectoralis muscle, it supplies this. Another branch arises which supplies our deltoid muscle, which is musculocutaneous nerve. From this posterior cord, few branch arises. Some of this branch supplies our upper part of the subscapularis muscle, and few branch supplies our lower part of the subscapularis muscle, then few branch supplies our latissimus dorsi muscle. Okay, so these are things. and the medial cord also gives multiple branches. So suppose it gives a medial pectoral nerve. I mean, this is the pectoralis major muscle. It supplies the medial part and also gives nerves to our, medial cutaneous nerve of our arm. Okay, medial cutaneous nerve of our forearm. Now the last part of the brachial plexus is very interesting. Okay, so we have already three cords. One is posterior, one is lateral, and another is medial. Okay, this posterior cord divides itself into two parts. It divides into two parts. One part goes as a radial nerve, another part goes as a axillary nerve. Okay, axillary nerve and radial nerve gone. Now this medial cord divides itself into two parts. One is ulnar nerve. Ulnar nerve goes this side of our hand, and the remaining part combines with the lateral cord, forms our median nerve. तो ये axillary nerve, रेडियल नर्व, अल्नर नर्व, मीडियन नर्व और भी जितने सारे ब्रांच है, इन सब के बारे में हम फ्यूचर में बात करेंगे. ठीक है, तो उम्मीद करते हैं आपको ब्राकियल प्लेक्सस और सर्वाइकल प्लेक्सस समझ में आया होगा. सर्वाइकल प्लेक्सस इतना ज़्यादा इंपॉर्टेंट है नहीं, मगर कभी कभी आपका क्वेश्चन आ जाता है कि ये ब्रांच कहाँ से निकलता है, वो वाला ब्रांच किसका पार्ट है. ठीक है, ब्राकियल प्लेक्सस तो आपके लिए बहुत ज़्यादा ही इंपॉर्टेंट है, हद से ज़्यादा इंपॉर्टेंट है. तो उम्मीद करते हैं आप लोगों को थोड़ा कुछ समझ में आया होगा. अगर समझ में आया है तो लाइक करो, सब्सक्राइब करो, शेयर करो. तो फिर मिलेंगे बाकी सारा पार्ट लेके. तब तक के लिए बाय.